Dr. Robert Schaedel. I'm a board-certified oral surgeon practicing oral maxillofacial surgery for approximately 20 years. I trained at University of Connecticut where I received my dental degree, my medical degree, and certification in oral maxillofacial surgery, board eligibility, passed my boards, and enjoy the full scope of practice, in particular implant surgery.
I'm Grady Crosslin. I come from a long history of people involved in dental technology. I'm a certified dental technician myself. We have a lab, Crown and Bridge Dental Lab in Dallas-Fort Worth area, and also here in the Southeast Florida region, with a primary focus on implant dentistry and kind of a synergy or partnership with the surgeons that I work with. So I try to align myself specifically with companies that have high quality standards, based with a heavy background on scientific research, have warranty and standards and broad spectrum of product portfolio, as well as companies who the people that I've partnered myself with, surgeons and restorative doctors, also prefer or use. So Straumann is one of the main implant companies that we have chose to also partner with. I do view them as a partner that through their success, I'm also successful. So
in practicing implant surgery and restorative procedures with dental colleagues, it's imperative to have a great relationship with your dental lab, your patients, and a good implant manufacturer. And by working with the Straumann product, I've found over the past 20 years, while having experienced many different implant systems, that the quality, the support, and the reliability is always there. Beyond that point, working closely with a lab, such as Crosslin Dental Lab, that understands our needs and will come to the office, and we've been invited to go to their lab, is extremely important in providing the very best for our patients. Well, I think using a good product certainly is a reflection of your good work. And if you were to use anything less than what you think is the best, then you may not be providing the best for your patients. So using Straumann products, which are made with great expertise and attention to detail and pride, is a reflection of my own work, and I don't want my work to be a reflection of other than the very best that I can do.
I think if my surgeons and restorative doctors put something in the mouth and have chose to go with the premium product, the #1 implant company in the world, that it's also my responsibility to ensure that everything we put on top of it is backed up by the same warranties and meets or exceed those same standards that are aligned with our own standards in our laboratory. From a lab perspective, the last few years, the trend has been to, generally speaking, to move to a more generic, cheaper, possibly abutments and components on top of implants. And so one way I've been able to differentiate myself as a lab has been to vocalize our commitment to original components across the implant line.
Mm-hmm. I think it's very important to understand that while parts are compatible with the Straumann system, they may not be authentic, and authentic parts essentially guarantee the level of detail that the manufacturer requires to have parts fit together properly. So knowing that you're placing original components on original product is providing the best care for your patients, and I think that is certainly something that differentiates myself and my partner from perhaps other surgeons that may choose otherwise.
The benefits of working with a company like Straumann just add to the overall patient care, and we don't have to. We have the quality assurance or the guarantee that something that we may put in their mouth is backed up by that long history from Straumann, that the components are meet or exceed a high level of standard.
When we work as a team, patient, doctor, restorative dentist, laboratory technician, there are some variables that are difficult to control, and we have to work through some challenges from time to time. When we use original parts on implants, that's one thing that we don't have to worry about. We don't have to worry about the product. We can always work through changes in a treatment plan, changes in a patient's medical status to ultimately arrive at the best possible care for the patient. But if we can't control the product by using nothing other than an authentic part, then that could be very frustrating when problems develop.
I'd have to agree. I think having a control, having something in a variable. We have so many variables in dentistry, especially implant dentistry, working in the human aspect, the oral environment, biology. That having those assurances of quality control standards, things like that, is just one more thing that we don't have to worry about and we can focus on the other areas of dentistry for the overall patient success.
Since I've joined the practice with my partner down here in South Florida, I've had the pleasure of meeting Grady Crosslin, who's become a friend and is a lab technician with which we work with quite a bit. It's comforting to know that he comes to the office, will ask any questions or concerns that we may have relative to the patient's care based on his services to the patient, and to have a great friendship and synergistic working relationship just helps the lines of communication so much that you can provide wonderful care in that fashion.
And Dr. Schaedel and Dr. Feinerman both have such a great teaching aspect to them that any feedback that they've been able to give me has overall improved the end result that we can deliver to the general dentist and to the patient. And so that synergy a lot of times isn't focused directly on just building each other's business as it is in providing a better end result in a happy patient or a patient who can now function in a way that they weren't able to possibly before.